Hello, everybody. My name is Mike Mulqueeney. I'm with Johnson & Dugan, and we're an employee benefits consultant in the San Francisco Bay Area, where we've been helping small to medium-sized employers for the last 38 years. And today we are, this is the second of a series of three little webinars that we're doing, 5-minute webinars with Heidi Ohja on cost containment solutions for self-funded health plans, specifically focusing on MSK claims. So Heidi, welcome. Heidi is the co-founder of AwareHealth. She is a clinician of 15 years with her doctorate in physical therapy and the top cited researcher in the world on how to direct access models or on how direct access models can lower orthopedic claims cost. Sorry, that was a little bit of a mouthful.
I love research, that specific area. So
good,
very
good.
passionate about that area.
Awesome. Well, then let's jump into it. How's that sound? So Heidi, most don't realize something can be done about high orthopedic claims and the cost of those claims. But what does your research suggest is the solution, or what needs to change?
Yeah, so I know in the last series we talked about how most employers don't realize that because 1 out of every 2 people have musculoskeletal pain, it's just so common that when you add up all the claims, it exceeds the cost of some of the other large claims like cancer, open heart surgery, and that type of thing. So once they understand their problem, we've included a link for them to access an Excel sheet with ICD-10 codes so they can determine their own musculoskeletal cost. Once they do that, then they'll understand if they have a problem or not. And then they're at the point where, okay, can I do something about this problem? So your question is like, what can be done about this? And I think the timing is so important. And a lot of vendors in this space see chronic pain as being very costly and snowballing into huge claim amounts. And I know from all of my research that the earlier you intervene, the cheaper the claim is going to be. And that just makes sense, right? Like if you do post-op ACL rehab, you add that to the cost of the surgery, that's a lot. If you get to the person before surgery and manage it just with physical therapy, then you subtract the surgical cost from that claim, right? So the earlier you get to it, the cheaper it's going to be. So our goal at AwareHealth is to intervene day 1 and really get employees to come directly to us over telehealth because we're highly specialized in the non-surgical domain. And a lot of them just assume they got surgery before, they need surgery again. And it's our job to lay out all the options and let them choose what they want to do. But oftentimes it's like, okay, well, the surgery and doing nothing is equally effective. And there's more risk of harm with surgery or longer rehab process. So I'm going to choose conservative and just work with you over telehealth. And so they kind of come to that conclusion on their own oftentimes. And that saves employers a lot of money because it's like avoiding unnecessary surgery, but also keeping their employee at work so they can be productive.
Right.
And, you eliminate that whole rehab process that sometimes can take up to a year.
And doesn't it, for orthopedic surgeons and folks in that world, sometimes, it can be tough to get in to see them, or they may have to wait for some time. And so they might be in a waiting pattern for 4 months or so before their turn to get in, to get this elective issue taken care of. And they could be doing something during that waiting time and potentially find out that they may not need surgery. Exactly.
Yeah. A lot of times, we even aim to get them better, help themselves get better before their first appointment with their insurance-based system.
Okay.
A lot of people come in and they're like, I'm seeing my primary next week. It's like, okay, we've got to see you a few times a week, make sure this resolves, and then they don't even need to see their primary. Maybe they have an orthopedic surgery appointment in a month. It's like, okay, well, let's get your knee better. And so by that point, when they have to decide if I should go or not, if their knee's completely better and they're running again, they cancel their appointment,
Wow, great. Cool. So how much do implementing these strategies save self-insured employers? Like, what has your initial ROI been? Can you give us an example?
Yeah, so we had some research published to give us a sense of how much we would save. And that was around 50% of the orthopedic claims bucket. And we didn't know if we'd be able to save that working with clients the first 6 months to a year of rolling out a program, because we figured it would just take time to change company culture. And we were shocked that the first employer we worked with, over a 6-month period of time, they saved 70% on their orthopedic claims costs.
Wow.
And we were like, wow, we didn't think it would be that fast. And again, there are some limitations in saying that it'll be the same every year, because it's such a short time period to track cost, and cost can be highly skewed sometimes, like just one surgery will throw off the whole group's average. But, it's certainly encouraging in the first program that we ran that the cost savings were that significant.
Wow, that's outstanding. Well, I think that's enough for today. We want to keep these short, and if anybody has more interest in this, you can reach out to either Heidi or myself. We're happy to help you, but we'll reach out again and send out a third session shortly, continuing this discussion on MSK claims. And we hope you all have a great day and talk to you again soon. Thanks for joining me, Heidi.
Okay.
Take care.